What are you willing to pay yourself? Imagine a world where you could pay yourself whatever you want. What would you set that amount per hour at? $100 an hour, $500 an hour, $1,000 an hour? Is there an amount where you'd start to feel guilty? Well, in the real world, we don't have to answer this question. We don't get to pick our own compensation. But there's one place, there's one reality where they get to set their own compensation. And today we're going to explore it as we journey into the Healthcare Twilight Zone. Hi, my name is John. I'm your healthcare hacker and host of the Healthcare Twilight Zone. We're going to continue to talk about how strange, bizarre healthcare is here in the US, how it truly is the Twilight Zone. Last week's tale was around a family that had to make an impossible choice between a rock and a hard place, between their daughter and money. This week's episode has nothing to do with a choice. In fact, our main character, Tom, had no choice. Instead, he was stuck paying an exorbitant bill because someone decided to charge over $10,000 an hour for his time. The main character of today's story is Tom. He's a long-haul truck driver, and his story begins on a Saturday. Tom is working, and all of a sudden his abdomen starts not feeling right. He's got some pain. He stops at a truck stop, hoping a little rest and some antacids will help. They don't. It gets worse. Eventually, Tom has had to take an ambulance to the emergency room at the local hospital. They examine him, find him that his gallbladder needs to be removed immediately. They call the on-call surgeon, and he performs the surgery. It takes about an hour and a half, relatively quick, and luckily, Tom makes a full recovery. But then the problems arise when he starts getting the bills. The good news for Tom is the hospital was a network. So the emergency room visit, the surgery, his stay afterwards, all the tests and procedures they did, all Tom had to pay was his deductible. The bad news, the general surgeon that did the procedure to remove his gallbladder was not in network. They're out of network. In fact, the surgeon doesn't participate in any network. He's always out of network. What's that mean? He can charge what he wants. So for this surgery, which took about 2 hours, a little bit less, and that's including some time seeing Tom before, and he saw him once after, he charged, get this, $22,000. $11,000 an hour, what the charge was. Now, you can say, John, but that's not what the insurance paid, and you're correct. Medicare will pay about $800 for a similar procedure. His insurance company paid about $2,000, but that did not satisfy the surgeon or his billing company, right? They billed $22,000, insurance paid $2,000. He wanted $20,000 more from Tom because it's out of network. And he could balance bill Tom for his time. We appealed this with Tom's insurance company. He said, you got to treat this as a network. We can't pay this much. Insurance company agreed. They paid another $3,000, so a total of $5,000. Did that placate the surgeon or his billing company? No. He still went after Tom. It was only after negotiating in months and months and months and threats of credit scores being impacted and collection agencies that we're able to get them to accept it. But just imagine that. He still got paid $5,000 for 2 hours of time. But it gets worse. You see, it wasn't just a surgeon. The surgeon had an assistant surgeon. Now, if you're, let's say, a carpenter and you have an assistant carpenter, you don't expect to have to pay the same for the carpenter as you do the assistant carpenter. But guess what? How much did that assistant surgeon charge? $22,000. The same amount as the surgeon. It's crazy. Again, Tom's insurance company paid even less, paid $200 for the assistant surgeon's time. So you can imagine, was that acceptable? No. Again, threats of collection, threats of credit scores. Luckily, Tom had Athos Health, and we could help him fight it. And it did take a fight. Because the Healthcare Twilight Zone isn't reality. You can charge $22,000 for 2 hours of your time and get away with it. while we may not think it's right, there's no illegality to it. It's completely fine. It happens all the time, but only in the Healthcare Twilight Zone. If you enjoyed this episode, please hit that like button below and follow Athos Health on your favorite social media platform. We want to get our story out. It's important to us. We want to help as many people as possible navigate the crazy Healthcare Twilight Zone. And if you've had your own experience, please leave in the comments below. We'd love to hear from you. And as always, make sure you get the facts by joining me in the next episode of Healthcare Hacks.